Golden notes. Wilson's disease. Wilson's disease is an autosomal recessive disorder characterized by impaired copper transport via ceruloplasmin, results in excessive copper deposition in the tissues. Impaired copper excretion into bile. Copper overload and deposition in tissues leads to predominantly hepatic and neuropsychiatric symptoms. Metabolic abnormalities include increased copper absorption from the small intestine and decreased hepatic copper excretion. Etiology and pathophysiology. It is an autosomal recessive caused by a defect in the ATP7B gene located on chromosome 13, and sometimes they ask about this chromosome. The onset of symptoms is usually between 10 and 25 years. Children usually present with liver disease, whereas the first sign of disease in young adults is often neurological disease. Liver, hepatitis, and cirrhosis. Neurological, basal ganglia degeneration, speech and behavioral problems are often the first manifestations, and they ask about this point. What is the first manifestation of Wilson? The most common early neurological sign is an asymmetrical tremor, and there is something that they really like to ask about. That is Kaiser-Fleischer rings, golden corneal rings in the posterior surface of the retina within its descendant membrane, detected by slit lamp examination, present in up to 90% of symptomatic patients, but is not pathognomic. And there are actually some debate about it is pathognomic or it is not pathognomic. So some references say yes, it is pathognomic. Some references say no. Renal tubular acidosis, hemolysis, and blue nails. Now the diagnosis: reduced serum ceruloplasmin, reduced total serum copper, but increase in 24-hour urinary copper excretion greater than 1.6. Liver biopsy, the most reliable investigation to confirm the diagnosis, shows increased hepatic parenchymal copper concentration. So in Wilson's disease, serum ceruloplasmin is decreased. This is very important. MRI of the brain commonly shows increased density in the basal ganglia. Genetic testing for ATP7B mutation, usually reserved for patients where the diagnosis is doubt, or for screening of siblings. Complications: there is higher risk of hepatocellular carcinoma. Now the management: there is general management, low copper diet, avoid foods such as organs, shellfish, nuts, and chocolate, hepatotoxic drugs, alcohol and foods high in copper like liver, chocolate, shellfish, etc. Regular check-ups, liver biochemical tests every 6 months if disease is stable, liver transplantation in cases of laminant liver failure. Now the medical therapy: initial therapy, chelating agents, penicillamine is first-line treatment, side effect in 30% of cases, sensitivity reaction and bone marrow suppression. There are some alternatives like trientine or zinc salts. Trientine may become first-line treatment in the future. It's better tolerated than penicillamine, is therefore used as an alternative where side effects are seen when penicillamine is initiated. Maintenance therapy: zinc salts or low-dose chelating agents. Zinc acetate is the intervention of choice for patients with asymptomatic Wilson's disease, those who present with elevated transaminases without evidence of cirrhosis or neurological dysfunction. Now screening for relatives: first-degree relative. Once a diagnosis of Wilson's disease is made, screening of first-degree relatives with genetic testing should be done. The prognosis: early treatment allow a normal length of life. However, Without treatment, Wilson's disease is usually fatal by the age of 40 years. And let's consider this diamond note. Treatment with chelating agent should be administered gradually over the course of 3 to 6 months, as mobilizing the copper stored in tissues too rapidly may exacerbate neurological symptoms. And there is a question from past paper which asks about the mode of inheritance of this disease. A 23-year-old woman developed unilateral hand tremor at rest, behavior and mood changes, speech problem, and bradykinesia. Dark circular marks noted around the iris. Her uncle died of liver cirrhosis at the age of 40 years. Given the likely diagnosis, what is the mode of inheritance? So the likely diagnosis is Wilson, and the mode of inheritance is autosomal recessive. This was provided by the SSSM Study Smart series for Mrcp, your easy way to easy pass. Don't forget to follow us on Facebook, Telegram, and YouTube channel. Thank you very much.